CMPRadio.net. It's the station.
CMPRadio.net, man. You already know it's your boy Uncle P, and today I have the pleasure of sitting here and talking with the people from Delaware County Health Department, and we're talking about STIs. We're talking about HIV. We're talking about let's get tested. Let's get out there. Let's get tested. We went over there today. We went through there for a couple minutes. I got tested. Yes, I got tested. I had some young people with me. It was up to the young people whether they wanted to get tested or not. I didn't force anyone to get tested. So if anybody's parents wants to talk to me, I'm here. You can talk to me. But your child chose to be tested, right? They walked in on their own accord and they wanted to be tested. But I went there and I got tested, and they'll be open, right? Get tested, own your health. They have a teen clinic every other Tuesday. Today's Wednesday. Today's the day where they do the free clinic. But every other Tuesday, they do it as well for teens, right? So, it's nothing wrong with your child being tested, you feel me? And making sure that they understand how important it is to know their status, where they stand with chlamydia, gonorrhea, syphilis, and everything else. Like, I know how hard and difficult it is to, as a parent, understand that your child is having sex. I know how hard and difficult it is as a parent to think that your children are doing anything other than what you want them to do. But it's real. So it's just about allowing your kids and taking your kids and letting them, listen, if you got a problem, if it itches, if it burns, if something's wrong with you down there, I need you to go get that checked out, right? And safe sex. So they also give you a bag of prophylactics, condoms, different sizes for, shapes and figures and all that good stuff. So that's good. So right now, I want to introduce my guests, right? And I'm gonna let them introduce themselves, right? So we can get moving. Michael.
Yes. Good afternoon. My name is Mike. I work with the Delaware County Health Department. I'm the supervisor for the STI HIV department, both in Chester Clinic and also in Yedin Clinic.
Yes.
Hi, my name is Natalie. I'm an STI and HIV disease investigator here, primarily located in Chester right now. Okay,
awesome. So, for listeners who haven't been following or listening closely, what is the current state of STIs here in Delaware County and specifically in Chester City?
So really, I don't have all the figures with me, but currently the number in Delaware County is high. But sometimes it might be a negative or positive effect as well, because we are doing more testing, we are doing more screening now compared to when the STI department or the department was opening. So now we have more people that are coming in, both in Chester and in Yedin Clinic for testing. And because of that, we know we'll have more results, which is either positive or negative results.
Right. So I'm gonna go through what I found out. Right, I'll make the data personal. Chlamydia dropped from over 3,000 cases to about 2,663 between 2024 and 2025. It's not a lot, but it's still a decline, right? So what do you think is behind that decline, and is that decline sustainable?
I do believe that people are more aware of like getting tested. Most people that do come in aren't so much aware when it comes to gonorrhea, chlamydia, especially when it comes to symptom-wise. So even when they do come in and get tested, they are getting promoted, like coming every 3 months. We always recommend getting tested every 3 months, even if you don't have any symptoms, get checked. Some do come every 6 months. So I do believe ever since when the health department opened up, we have been promoting, prevention, getting tested, and we have seen that increased numbers of people coming in and getting tested.
Okay. All right. Gonorrhea and chlamydia cases are trending down statewide, but syphilis, I know they have a syphilis test now that the Delaware County Health Department is giving out, right? The syphilis numbers have stayed flatter. Why is syphilis proving harder to move?
Well, in relation to syphilis, it's different from gonorrhea and chlamydia. Like syphilis is normally in your blood, and also the treatment is also different. For gonorrhea and chlamydia, once you are tested and you are positive, once you're treated, it goes away.
Right.
But syphilis is different.
Okay.
Even though you are tested and you receive the right treatment, it doesn't go away like that. It's similar to like COVID.
Okay.
When you are tested for COVID and you're treated, but you have the residue in your system, it's the same thing like syphilis. So once the test is done and you receive the right treatment, you ever remain to be tested positive, although you will not be able to transfer it to another person. And it's a little bit difficult, like the treatment also for gonorrhea, treatment is one shot and it's done.
Right.
For chlamydia, sometimes it's 7 days. You take pills twice a day for 7 days, or you take one for a day.
Right.
But for syphilis, based upon the symptoms, the treatment might be for 14 days or for 28 days. That's the pills. Or you take shot for 3 shots, that once a week or one time. So the treatments are different. Wow. So it's like if you don't take the correct treatment, then you still have it in your system.
Right.
So if you're supposed to take pills for 28 days, you just took it for 14 days. It's like you're not treated.
Right.
So that's how bad syphilis is. So that's why it's very difficult to be treated compared to gonorrhea and chlamydia. So with that range, that's why the number is still, it's still steadying. It hasn't declined yet. But we know with effective treatment and effective testing, the number will eventually decline.
So what are the things that you have when you have syphilis, right? Just so people will know, right? Because I've never had syphilis, right? So I don't know what syphilis is. So can you give us the ins and outs?
So syphilis is a sexually transmitted disease. You can have it through oral, anal, or vaginal sex. So the thing is, once you have sex with somebody that has it and the person wasn't treated, then you're going to have it. And we have stages of syphilis. We have the primary stage, the secondary stage, the tertiary stage. We have the 3 different stages of syphilis. And sometimes we have a stage which we call a 745, which is a long time stage, like people that have had it for a very long time and the person wasn't treated. So the primary stage, once you have it, you can have like sore on your vagina or sore in your mouth. And 4 to 6 weeks without taking medication, the symptoms will go away. Yeah, so you will not know that you still have it. And the second, then it will transfer to the secondary stage, which you have like a body rash or rash on your palm or under your feet. Also, likewise, like the primary stage, it will go away without even taking medication.
Wow.
But that doesn't mean you don't have syphilis.
You don't have syphilis.
Then you have this 3rd stage, also with no symptoms. So after a very long time, if it's not taken care of, it's going to start affecting your eyes. It will start affecting your organs. And if a woman who's a childbearing age, sometimes if a woman is pregnant, if it's not taken care of, it's going to affect the baby. Oh. So that's how bad syphilis is. So those are the stages for syphilis that we normally go in. So once a patient comes in and the patient is tested, if there's a positive result, we ask all those questions to know the stage that the patient is at.
I just also want to add.
Go ahead, please.
I do believe like sometimes symptoms can get messed up, as Michael had mentioned. Like sometimes even the rash and even the sore can just go away. They could just think, it's just probably nothing. Right. And they could think, especially right now with the heat, they could think it's more like a heat rash.
Right.
And then like if it's not going away, do follow up with a doctor just to make sure
Right.
and get all the proper testing needed too as well.
Yeah, if I got a rash, I'm going to the doctor. I don't know how. Maybe he's seen it before, right? Doc, what is this, right? Because the only way to treat it is to get it, for someone to say what it is. You know what I mean? Like I don't want to be treating a heat rash, and I got syphilis. Like that's crazy. So,
and also just to go, sometimes there's even no symptoms. You cannot even see.
Like that. I don't.
Yeah, so that's the thing again. Sometimes you might have it with no symptoms, as I would call asymptomatic, no symptoms until you are tested, and they will only know that through a blood test.
Only know that through a blood test. So on Wednesdays you do a free clinic here at go ahead.
So at the initial stage when the clinic was open, it was just on Wednesdays.
Right.
But we thought it fit because we are serving the community,
Right.
and if somebody is not able to come in on Wednesday,
Right.
what's the next remedy?
Right.
So we thought it fit to open 5 days a week.
5 days a
Currently
week.
we are open 5 days a week, Monday through Friday. From the clinic is open from 9 to 3.
Right.
We are open here, and we do free STI screening, and we also do free treatment.
Right.
So we're open. Before it was only on Wednesdays, but
Now it's every day.
Yeah, every day.
So every
Except
day.
there's a holiday.
Right.
Yeah.
Give them the address.
Yeah. Our address is here is 151 West 5th Street. That's where our location is at, and there's also a parking lot at the back. So, and we do walk-ins, and also we do appointment basis.
You today you tested me,
Yes.
right? So we'll get my results on Monday. I just want people to understand how simple it is. I walked in, you feel me? I was in there in the waiting room for about probably 15 minutes. Walked into the back. You introduce yourself, right? Very, very, very people friendly. Walked to the back, sat me down, explained what you had to do. You had to draw blood, you had to swab my mouth, and I had to be able to urinate in a cup. Did all of that. After that, it was done. I was out, right? You told me I'll have my results by Monday, right? You'll hit me up, you'll call me and talk about my results on Monday. I think when we think about a clinic or we go somewhere, some people are scared of the needle, right? Some people just don't want to know. I don't know why, right? What do you have to say to the people that have fear, or have you ever had anybody come into the office and are scared of needles and stuff like that? Is there another way around that, or we have to get blood?
For syphilis and HIV, there is no other way around that because it's in your blood. So that's why we have like different type of needles. Like when you went in, we use the smallest needle, which is it's a little bit, you can just feel a pinch, just like when you went in, you just feel a pinch. Because like some people, based upon when they see the needle, a big needle, then they are all scared right away. So we also take that into consideration as well. And we try to explain to the patient, what they're going to feel once we use the needle. And really, we've been really successful in testing patient.
Right.
Like, rarely a patient will come in and say, I don't want to be tested for HIV or syphilis because of the needle. Because we try to talk to them, we try to encourage them, and we also try to tell them the importance of testing.
Right.
So we've really been successful in that, in testing patients for HIV and syphilis.
Yeah. Are there partnerships happening locally with churches, schools, or community organizations to get tested and get education into Chester specifically? Outside of what y'all do with me on Fusion Friday and the Delaware County Health Department comes out for Fusion Friday, but other places, other outreach, community outreach situations?
Yes. To start with, we normally go to colleges to do free STI screening.
Okay.
We've been to Widener, we've been to Swarthmore,
Right.
and we've been to Haverford College. So we go to colleges every year to do STI screening, and we've noticed some positive test results also. Positive result for HIV and syphilis.
Wow.
So, and also gonorrhea and chlamydia.
Okay.
So normally once we go in and once students are tested, we also do free treatment. We inform them about their test results, if even they are negative, because that's, we normally inform negative and positive result. Right. And if they are tested positive, they can either come to our clinic for treatment, or they can go to the college for treatment if they deem it fit. And furthermore, we do also community outreach as well. We go out in the community, we give out flyers, and we give out our brochures, STI brochures, and we give out giveaways, informing the community that we are available at your location for free STI screening. And also, our goal is really to go into like high schools to do free STI education and even, if need be, STI screening. But we've been finding it very difficult to do STI education in high schools.
How are you finding it difficult to go into high schools to talk to children about protecting themselves?
Well, there are so many barriers and boundaries to cross.
I like to know what barriers there are.
Yeah, the thing is, to start with, we have to send in, like, talk to the director, whoever is in charge, that this is our proposal, and this is what we want to do. But like some will say, we'll get back to you, but to no avail. It has been since I became the supervisor about 2 years ago. We've been trying. We've been really trying our level best just to do STI education, but to no avail. We've been finding it very difficult. And now we've been seeing, teenagers coming in with gonorrhea, more with chlamydia and gonorrhea positive test results.
That's crazy. All right, so and I'm gonna try my best to help you out with that. See if we can get in Chester High, right?
Wonderful.
Even if we have to do it around, CMP comes into the high school and we hold a podcast.
Yep.
And inform the children the importance of getting tested, knowing where you stand, right? And that it's not a bad thing. Next week, I'm doing an interview with Dr. Deb. We're going to talk about PrEP. But you were telling me that there's another organization in the city of Chester that deals with PrEP, right? Can you give me that organization's name?
Yes, the current organization that we really link with now is called ACG, AIDS Care Group. They do PrEP and they also treat for HIV. Because for us, for the health department, we don't currently treat for HIV. We only do free screening, and if there is any positive result, we refer them to AIDS Care Group, ACG. And they are a wonderful organization. Been collaborating with them since the institution, since the health department opens, and they are always and all the time willing, to talk to us and do a lukewarm handing over to any patient that's tested positive for HIV, and those that want to be on PrEP.
Right. Okay. All right. So we're going to get into prevention, access, and resources. What free or low-cost testing and treatment options exist right now for someone listening who's worried but doesn't know where to start?
So we do have, as I mentioned, our clinic. We actually do have two locations, the one here in Chester, and we also have one in Yeadon as well.
Okay.
The address is 125 Chester Avenue in Yeadon. It does also have a parking lot. And also part of the testing, we do hepatitis C testing too as well. You can always come into, as I mentioned, walk in too as well. ACG is another clinic that does walk into testing where you can walk in. Another place you can also check is also Chest Pen 2 as well. Most of the time, like, we have our flyers. We also do have on 69th Street and also in our Yeadon clinic, we do have a machine where they do testing. It's like a free testing. They have everything, first aid kit. They also give condoms. They also have gonorrhea, chlamydia, and also syphilis testing. And there's no cost to it. You can always just put in your zip code, and it just gives the items too as well. And you just pick like what items that you want. Okay. So we do have one in front of our courthouse in Media. We have one, as I mentioned, in 69th Street in Upper Darby. And then there is one in front of the Yeadon Clinic too as well.
Oh, awesome.
Yeah, and in relation to that, we have for now locations that will have the kiosks that Natalie was talking about. We have one in Yeadon and we have one in the government center. That is 201 West Front Street. And we have one at Keystone First Wellness Center. That's 1929 West 9th Street. And we have one in Media County Community College. That's 901 Media Lane. So we have all those kiosks and everything is free in there. We have first aid kits, we have STI, HIV test kits, and we have different stuff in there, and everything is free. And you can it's a free testing, and the directions are all in the test kit. Once you go in, you do your testing, you just drop it off at the post office, and your results will come in. So they just need basic information once you pick it up from the kiosk.
Okay. All right.
And I will leave the information with you once.
Yeah, leave that information here. Send it to me via email if
Okay,
you
I will
can,
too.
and I'll share it. On see. So again, like it's not all about money. It's about information, right? So a person that has information, you feel me, that can share it to the community. That's a good person, right? So give me the information that you have, send it to me, and I'll share it. No problem. Delco, I hear Delco has a free mail order condom program. Is that something I can reach out to somebody and get some condoms delivered to me?
So it's in works. So you can reach out to us.
Right.
So we did have it going. So you can reach out to us that we normally do that program. But it's still in works.
In the works. Okay.
Yeah, you can. And also, if you want a free condom, you can go to.
Yeah, come down
You
there.
can come
Yeah.
to us.
Okay.
We can give you. Just let us know in advance the
Right,
quantity
right.
that you will need.
Yeah.
Because the thing is, we try to mail it, but it was very expensive just
Right,
to
right,
mail
right.
maybe
Absolutely.
like 2 or 3 condoms.
Right.
So now, if anybody comes in, like
Get a whole bag.
Yeah, we have so
Right.
many
Yeah.
organizations that are coming in.
Absolutely.
Like we need condoms or we need brochures for for our programs. It's something that we'll give out free.
Okay.
So once you come to either Chester Clinic or Yedin Clinic and inform us, or you can just send me an email that we need such amount of condoms. Is something that we can.
So I know back in the day they used to say, if you go take a test, you get chlamydia, you have to then say the partners that you had, right? What's the role of partner notification and disease investigation? Because that's what you say you do, right? Once someone tests positive, how does that process actually work? Right. So if someone goes in there and said they had sex with me and put my name down, I'm gonna get a phone call telling me I got to come in and get checked.
So how the process works is that we do highly encourage our patients to encourage the partners to come and get tested, and we do ask for for partners. So we do ask their name, their number. We do reach out anonymously. A lot of it is anonymously. We don't call and tell the partner, oh, so and so gave your name. So we do anonymously. We reach out saying you've been exposed to an STI. We do recommend for you to come to our clinic and get tested. So when we do reach out to you,
You're not gonna tell me who gave you my name?
no,
That's not fair.
It's anonymous.
They gave you my name. I need to know who gave you my name.
It's anonymous, and some people are afraid that they don't want the other partner to know, and they're just worried. So that's why, to make it easier and comfortable, we do anonymously reach out to people and just recommend for you to come and get tested.
We be okay with the lies. We can't. We got to tell people. No, I get it. I totally get it. I understand it, right? And that's a good way to do it. If someone doesn't have insurance or a regular doctor, what's the very first call or step they should take to come and get checked?
Really, there is the first step is to walk in. Because we do walk in, I'll also do on appointment basis. So the first step really is to walk in and let us know that you're here for STI screening. There is no insurance, no copay, no nothing. So once you come in, we just ask for demographic and we do free screening. And if you are positive for gonorrhea, chlamydia, and syphilis, we also do free testing as well. Okay. So everything is free.
Everything is free.
There is no copay, no insurance, no nothing. So everything is free.
Everything is free.
Yes.
Youth engagement. What does effective STI education look like for teens and young adults in this community, and where is it currently falling short?
To start with, I'm going to start with the parent.
Right.
Like most time, what we've experienced is when normally a youth or teen goes in for testing, some of them we give them, their parents' information, including telephone numbers. So once we call to inform their parent, to talk to the kid or the teen that they are positive for whatever, either gonorrhea or chlamydia, sometimes the parent will say, if the kids give us, because the kids have to give us consent to talk to their parent. 13 and above, they have to give us consent because some parents think it's 18, but unfortunately it's 13. So once they give us consent and we let them know that your kid was, became in contact and was positive, and they say, oh, my kid is not having sex. Some parents, they just think it's just vaginal sex that your daughter might be infected with STI, but it's not. People can be infected through oral sex as well. So your daughter might not be having vaginal sex, but your daughter might be having oral sex.
Right.
And your daughter can be contacted with STI through having oral sex.
Mm.
So most times once that happens, they come in for STI screening. But like a kid or a teen can come in age 13 and above without parents' consent. So they can be tested and also treated with no insurance and no copay.
Okay.
But I know kids might, sometimes we find it very difficult for them to come in. That's why we have the alternate Tuesdays for teen clinic, so that at least that will just favor in for for teenagers to come in for STI screening and also STI treatment if needs be.
Right. Now this isn't new, right? I remember when I was younger, they had the I can't remember the center up by Crozier, where they gave out condoms and they did STI treatment and all that good stuff, right? And it was always walking in and seeing people in there, right? So it's the embarrassment of it, but in all actuality, like, I'm coming in to make sure I'm straight, right? And you're here to make sure you're straight, so it shouldn't be any backroom talking when we leave here. For the children of today, what do you have to say to them to get them to be okay with coming into the clinic, right, to get tested?
So for the children today, we also like when you went in,
right,
to start with, we didn't call names,
right.
Yeah.
You just
We
said, oh,
called
number
numbers.
one, right.
So to just avoid, because the thing is, we don't know who is sitting close to you. Maybe you might know the person, or you don't even know the person.
Right,
but by
right.
calling your name, they will know, oh, this is the person that came in. So we implemented a number system where once you come in, you do your demographic, they will give you a number, and once we come to call you by your number. And at our clinic, we don't only do STI, we do all other stuff as well. So kids will come in for other like for immigrant, they will come in for TB.
Okay.
So it's not everybody's coming in that is coming in just for STI.
Right.
So we are encouraging teens to be tested. Once you have had unprotected sex, and it doesn't necessarily mean to be a vaginal sex. Once you've had unprotected sex, we encourage you to come in for STI screening, and it's something that we don't relay out because we are really the important thing about HIPAA violation. That's something that it's something that we don't joke with. It's
right.
something that we don't play about.
Absolutely.
HIPAA violation. That's why when you went in today, the rooms are all different. And we don't call by names. And once everything is done, the information is just with us, not even your parent. That's how I encourage things. If you have your telephone number, if you give your telephone number, that's the number we'll have to reach you to.
Right.
Don't just call somebody else to
inform them.
But we always encourage teens to come in as well.
And I just also want to add, a lot of times some teens will think that, they have to come with their parents. When I do talk to the teens, I do reassure them, you don't have to come with your parents, you can come by yourself. And even talking with them, because some of them may be unsure or don't know much about the STI infection, it is good to just talk with them. And a lot of times I do ask, if you have any questions, you can always feel free to reach out to me. Because it's better to know about, these things out there, the STIs, instead of just wondering, how did I get in contact with this? Or it's not possible for me to get in contact with it. And some teens may think I just have one partner.
Right.
But they could have had a different partner beforehand, never got tested. And then you guys slept together, and now you have an STI infection.
That's how it gets passed on, right?
Yeah.
Not knowing. And I know this is a question that's about the radio station, but what role can community radio or local media play in getting accurate information to young people who might not trust a clinical setting, right? And like I said, I'm just asking this question to know what you might want from me. You know what I mean? How can I be of service to you?
Well, I was so happy and glad that I saw you at the clinic today because you've seen. Because the thing is, sometimes just explaining it is a little bit difficult than you doing it yourself.
Absolutely.
So you've experienced it, how the process goes. So it's something that you can also, just like when we started the program, you express what, how the process worked when you went to.
Absolutely.
So it's something that you can also, tell the community, by yourself, and you experience what you observe when you went to the clinic. Because just by explaining it, without going there, sometimes it's a little bit, some people say, has he ever been there before? But now if that question is asked, you will know, yes, I've been there and I've gone through the process and I know how the process works. So it's something that we just encourage guys to let the community know that we are here to serve the community. We have 2 locations, one in Eden and one in Chester, and everything is free. And our role and responsibility, I know we cannot eliminate STI, but we can reduce it. And we can reduce it by individuals coming in for free screening,
Yes.
by individuals coming in for free treatment as well.
Absolutely. Stigma and community dialogue, man. What's the biggest myth or misconception you hear from people about STIs in this community?
I would say more that, like, they didn't have any symptoms, that how can this happen? And as I mentioned before, most of the time people that do come positive for like any STI, they don't have any symptoms. So it's more common to not have any symptoms. And when they do come in for like testing, they're like, oh, they don't have any vaginal sex, but you had oral sex. So that's also another myth, where they don't think that you can get infected through your oral sex too as well.
And for HIV in particular, the stigma is still there.
Yeah.
We normally experience like people having positive for HIV. Some people, they think your life is done.
Right.
Once I'm positive for HIV, I will not be able to do anything no more.
Right.
I cannot have baby no more. I cannot have partners no more. So because of the stigma, people sometimes are scared to even test. And some people are even scared to even discuss that with their relatives or their friends. But things have changed. Now, if you are positive for HIV, there are medications that are available now, which are free also. And ACG does do free treatment, HIV treatment, wherein it's a medication you can take for the rest of your life. Pills is like on a daily, like you take it once a day. And once that happens, if you really take your regimen according to the way it's prescribed, you will not be able to transfer it to nobody else. You can even have baby without the baby having it.
Wow.
So that's the most important thing. You can have your job, you can do your regular work regimen without even, knowing that you even have it, without even individuals knowing that you have it. So the thing is testing and treatment. That's the most important thing. Once you receive your treatment on a daily basis, that's why some people have patients that have had HIV for 10 years or 15 years and they are fine.
Right.
Yeah, they are really wonderful. They are doing wonderful because they are taking their medication as prescribed.
Wow.
And they are always regularly, being tested, because we want it to be on your viral load should be undetectable. That's why you want your viral load to be for the rest of your life. Wow. And when that's happened, you cannot transfer it to nobody. So really, there's still stigma, more so with HIV. But we want to tell the community that, there are treatment now that can help, if you are positive for HIV, and that is not like before, maybe like 10 years ago we are in, once you have HIV, you're done.
Right. It's not like that anymore.
No more. Yeah.
So my last question, well, not my last question, but my last question in stigma community and community dialogue, what would you want someone who just tested positive to hear right now? You basically said it, right? You can live for the next however long you want to live, right, without giving out HIV. You can have children, you can have a job, you can do all the things that you were doing before, right? It's not a death sentence. So I'm excited about that. Looking ahead, what's one policy change or investment that would make the biggest difference for Chester City residents specifically?
One policy really is having us having access to do STI education in high schools.
Right.
Because the thing is, it starts from there. Because most of the kids, they don't even know, how they can become have STIs.
Right.
So really, if that policy changes, it doesn't necessarily make, sometimes they just think education is telling your child or your kids to go have sex. Mm-hmm. Really, that's not the case. It's just education to let them know if at all or peradventure you start having sex, these are the things that you should be careful of. Or these are the things that you should take care of. It's just like, driving.
Right.
You cannot just go to the car and start driving without the driver's, test, going through the driving test. There's a reason why. So it's the same thing. Like STI education is very, very important because it starts from there. So if that policy is really changed, I know Philly, because I used to work in the health department in Philly. Philly, the STI department does STI education in high schools, and they also do free STI screening as well.
Right.
Yeah, they do urine tests in high schools.
Right.
So it's something that if we can implement in Delaware County, I believe that will help a whole lot.
Yeah, absolutely.
In reducing the rate of STI. And our children, we know, because sometimes they might be having sex as parents, you might not even know, because there's nothing that will tell you that they are having sex.
Right.
Until maybe something happens.
Right. Until somebody comes home pregnant.
Yes.
Right.
So he said, so that's the only time sometimes you will know. Or maybe they get sick.
Right.
And they go maybe to see their PCP and they say, okay, let's just do a urine test.
Right.
And now there's a positive test for you that gonorrhea and chlamydia.
Right.
Because most kids some of them will be afraid to tell you, I'm having sex.
Right.
So it's something that we are.
It hurts, right?
Yeah, we are really trying to encourage, the county for STI education in school, because it will be helpful greatly. We don't want the number to go high up. Wait till the number goes high up before we start implementing strategies that we already have, that we will have implemented it at the earlier stage. That will really help.
All right. Well, what's one action you want every listener to take after hearing this conversation? Come down to the clinic and get checked out,
get
right?
Tested.
Yeah, get tested. Let's go.
Get tested. Everything is free.
Right.
Yeah.
And we are really bent on HIPAA violation.
Right.
So we will not relay your information to nobody. Come get tested. We are open from Monday through Friday, and we do free STI screening. We test for gonorrhea, chlamydia, HIV, syphilis, and Hep C, and we also do free treatment as well.
Right.
And then don't forget, also bring your partners. It's important if you just one day, hey, like randomly, let's just go get STI tested.
Go on a date to the. I know it sounds crazy, and people will say no, you didn't. But I took a date to the clinic. You feel me? And we went in there and got tested because I need to know what you got, and you need to know what I got.
Because the thing is, having a partner, we ask about all other things.
Yeah.
But the major thing that we don't ask is about STI.
Right.
We ask about, sometimes going forward, they ask about different stuff, but we don't ask about STI. And sometimes it's very tough for even some partners to tell you the truth.
And if you can't tell me the truth about that, you don't want to be with me.
That's the thing. So it's easier to say, we are dating. Okay, let's just go for.
I get my results, you get yours, and we pass our results off to each other, right?
Yeah,
that's trust.
Yeah.
Now I know 100% what you have, you know what I have, and you can make your decision based on that.
Yeah.
And I think that's even. You feel me? Now we're starting off our relationship, our friendship, or whatever it's going to be, on an even note. You know what I have, you know what I'm dealing with. I started off, I have 8 children, and they be like, that's too many. All right, cool. That's no problem to me.
Yeah, because really we've had some patients that have come in, and some of them they didn't even know that their partner has STI until they are tested.
Until they test
and
it.
they'll come in like crying and stuff. Oh, you didn't tell me, and stuff like that. So that's how I always encourage, partners. Just be tested.
Yeah, I got questions for Dr. Deb, right? Because we talk about prep. I'm not going to get into the questions with y'all. I'm going to talk to Dr. Deb next week, next Wednesday, 12 o'clock. We're going to talk about prep and PEP and all that good stuff and figure out whether or not I should have prep, right? Just to make sure somebody said, I had a conversation, they was like, well, that's for gay people. I was like, why are you going to do that? That's not just for them. That's for anybody, because anybody can be affected with the HIV virus, right?
I think that's another stigma too.
Right. No. Now I get the commercials. So the commercials lead people to believe that, but we need to talk to the people that's making this medicine and say, no, we need more unison. We need to be included in what you're talking about, right? So that we know it's for everyone and it's not just for one select group of people, right? So I want to thank y'all for stopping through. You feel me? I appreciate it. I truly do. And like I said, Mike, anytime you hit me up, I want to come through and talk. I got some information I want to give. And you're more than welcome to come through. Today's sources were sourced through the Delaware County Health Department, their 2025 annual communicable Disease Surveillance Report. The WHYY case of syphilis and other STIs drop in Pennsylvania. And Delaware County Board of Health, their consolidated report 2025. I want to thank everybody for tuning in. I want to thank our guests for stopping through. Again, like I said, Mike, anytime. Okay. Anytime you want to come through, we can do this, and let's see how we can get into the school district and talk to the kids. Whether it's just a podcast and y'all just talking about it and offering free resources afterwards. Let's try to get that done. Okay. All right.
Okay. So I want to thank you for your work in the community, and we're here to serve the community. We are available at any time, and we hope that more people in the community will come in for free STI testing.
Absolutely. CMPradio.net, man. You already know it's the station. Be tuned in, man. I got another podcast that's about to start at 1 o'clock. We're talking about the stock market, man. King Ananias, Malcolm Flamer, man. You already know, man. CMPradio.net.